You're not going to get the pharmaceutical companies not very interested in this at all. Some of us have been trying to get the NIH to study it, but as we found out, there's a lot of politics involved in everything. And it's very, very difficult to get that kind of work done. Although, at the most recent meeting of the IPT Association, this is what I've described basically as insulin potentiation therapy. At the most recent IPT Association meeting, we had a representative of NCAM, the National Center for Complementary and Alternative Medicine. It's a subgroup of the NIH, and they did express some interest. They wanted best case studies, and they want us to be able to give them that information so they can make some decisions on whether or not to go further to look at an actual ongoing study. So we now have a mechanism of killing cancer cells that may actually be safe. It seems that the side effects are actually extremely low. And in fact, this is being done all over the world by a few doctors, not very many. There's perhaps 200 people were trained, maybe only 30 or 40, maybe 50 active people around the world who are doing it. And it's actually working. It does seem to kill cancer. We've had patients who've come in, a patient from Canada I just happened to see recently in follow-up, who had 2 large breast tumors, who was recommended to have a mastectomy, who came in, did IPT, insulin potentiation therapy, for 6 weeks. The tumor shrunk well enough so that a local surgeon was able to take them out. He took them out, he sent them to pathology for examination, and found that the lumps no longer had any cancer cells in them. They were completely cancer-free. And so we know it works. There's no question. This is a biopsy-proven cancer patient. And we've seen this over and over again. We've seen stage 4 cancer patients go into remission, complete remission, with dropping tumor markers, disappearance of lesions on x-rays and PET scans. We know it works. It's not, but if this were all it is, it would be a nice type of treatment, but it wouldn't be very much better than the rest of the way medicine approaches cancer, which is to look only at the cancer as some kind of foreign thing that has to be killed, rather than to look at the biologic terrain. It's very important for us to look also at the way people's bodies work, and to look at all these 6 pillars, to look at their diet. Remember, we just talked about it. People who have a high sugar diet, people who are diabetic, who have metabolic syndrome, who eat a lot of refined carbohydrates, have a higher incidence of cancer. This is also known statistically. There's been recent research in the last 2 years, particularly with breast cancer, colon cancer, prostate cancer, and now even lung cancer, that suggests that people have a better prognosis if their diet is low in carbohydrate, low in refined carbohydrates, low in sugar. This is interesting. I mean, do any conventional doctors talk to patients? Most oncologists that I've spoken to, and most patients that I've spoken to who've spoken to oncologists, the oncologists say, you can eat anything you want, just keep your weight up. And they actually encourage them, in the chemotherapy rooms, they encourage them to eat ice cream and cake and candy afterward. Doesn't make sense based on what we know. There's something very, very wrong with this approach. So diet is very important, and the statistics now are coming out more and more that not only as people have a higher incidence of cancer if they don't follow a good diet, but they also don't recover as well from cancer. Exercise. Again, in the last 2 years, research has emerged that say that breast cancer patients and colon cancer patients have an improved outcome, improved longevity if they exercise. Exercise is absolutely crucial. It actually lowers our insulin levels the same way that diet, a low carbohydrate, low refined carbs, low glycemic index diet also lowers our insulin levels. Now, lowering insulin levels, you now know by this description, is a very important mechanism to prevent cancer. Don't forget, we give insulin just that one moment at the time we're giving chemotherapy. even a small dose of chemotherapy. The whole rest of the time, you want your insulin levels to be low or almost non-existent. You want your blood sugar to be evenly low, no spikes. We don't want to give anything for the cancer to feed on. We want to feed the body, but not the cancer. So we talked about diet, we talked about exercise. It turns out that there are a whole bunch of supplements that are very powerful, have very powerful anti-cancer properties. Now, most of the time, when patients go to an oncologist and they get chemotherapy or radiation therapy, they're told not to take supplements. Well, the thought is that supplements will protect the cancer cells from radiation or chemo damage. Now, that damage is thought to be caused by free radical damage. That's an interesting theory, but it turns out that the people who've actually studied this combination of antioxidants and chemo and antioxidants and radiation have found the opposite. There were 2 review articles that that were published recently. One was by a board-certified oncologist from Chicago, Keith Block. He studied approximately 8,300 patients combined with about 20-some-odd studies. All of these studies showed antioxidants used along with chemotherapy. Now, only about a third of them addressed the idea of outcomes. They all looked at side effects. In every study, side effects were reduced. So most oncologists say, okay, I'll give you that. Will you reduce the side effects? Interestingly enough, not only did the side effects get reduced, but all the patients who were taking these had more likelihood of finishing the complete course of chemo. You know, a lot of people have to drop out of chemo because the side effects are terrible. 1/3 of these patients, approximately 2,500 to 3,000 patients in this whole group of over 8,000 patients, 1/3 of these patients that were in studies that actually looked at outcomes. And guess what, folks? Outcomes were improved when patients were on antioxidants during chemo. Improved. So this idea, which is an interesting idea that oncologists have, but it's based on no data. It's based on pure theory that does not seem to be borne out in reality. So another doctor, Dr. Charles Simone, is also a board-certified oncologist and a board-certified radiation oncologist, did a similar meta-analysis of studies that combined chemo and radiation and antioxidants, came to the same conclusions. A third doctor, who was a naturopath, who I'm sure they would have completely dismissed because he wasn't an MD, also did a meta-analysis and again came to the same conclusions. Folks, it's very clear that when you actually look at the data, antioxidants help. And Ralph Moss, a researcher who is fairly well known in the cancer community, he also is convinced that antioxidants do work when combined with chemo. So not only do we utilize the IPT to kill cancer cells, but we focus on the biologic terrain. We look at patients' diet. We look at their exercise regimen. We look at these supplements, which have a very, very big impact. There are supplements that are anti-angiogenic. They actually can interfere with blood vessel growth on cancer cells. And we have some patients on a very simple anti-angiogenic protocol who are continuing, stage 4 cancer patients, who are continuing to get better over time with doing nothing but anti-angiogenic protocol. So these are things that are very interesting, non-toxic, and a very, very effective way in some patients. Again, not everybody. If I had the secret to cancer, I wouldn't have to even be talking about it. Everybody would come, no matter how much it was tried to be suppressed. The truth is that nobody has a secret. Nobody has a 100% cure. But there are things available if you have an open enough mind and if you allow yourself to think outside the box, which often does not happen in conventional medicine. There are things that can be done for cancer patients. Detoxification that Dr. Calapay just talked about is absolutely crucial. We have our patients with high lead values, high mercury values. These must be addressed. They can very much reduce immune function and interfere with the ability of the patient to heal himself. So chelation can be part of this. Vitamin C drips can also help reduce the burden of heavy metals. Vitamin C improves immune function. And when you give it IV in large enough amounts, it actually has anti-cancer properties. It's cytotoxic to cancer. It actually kills cancer cells.